Okay, we're good.
All right, so I just introduced myself.
Yes, that's it.
Okay.
Thank you.
Hi, I'm Reverend Andree Mall. Pronouns are they, them, she, hers. I am the minister of Central Unitarian Church in Paramus, New Jersey.
So, could you talk to me about your experience with being an LGBT person in Bergen County? What is it like not having a LGBT resource center to rely on in this county?
Yeah, the personal example I can give is I just recently moved here to start a new ministry job here in Paramus, and I was moving back to New Jersey from out of state. I was living in northern New England. And so the first thing I did was look up to see, where's the local pride organization? Where's the local LGBTQ community in Bergen County? And when I looked that up, all the results I got were pretty much all in Manhattan. And I'm like, I know, I lived in Manhattan. Like, I know what's there, but I want something based in my community, right? As a trans person, I had healthcare needs. And have had the unpleasant experience of going to health providers that don't know how to deal with my trans non-binary body and health needs. And I couldn't find any information for Bergen County. And then when I did connect with providers who were outside of Bergen County, who were knowledgeable, their response to me was, yes, it's very unfortunate there's actually nothing in Bergen County. And so I moved here in 2019, right? So this is only a couple of years ago. So I was cobbling together my own resources and my own, community as I moved here. And then also being a minister and being an out trans person and queer person as a minister, I often have a situation where people come to me for connection or support, especially families with youth, who are just coming out, right? And as a minister, I can't be their only support. And in previous jobs, what I've often done is build a relationship with the local LGBTQ center. And I know what their programs are. I know who the people are over there. I know what the resources are. And as I meet with individuals or families, I can help say, hey, here's where you go. And I've had nothing like that here. I know little bits and pieces. I know where PFLAG is. I know some folks there. And I've had to kind of cobble this together myself. And it doesn't feel adequate to me. It feels very decentralized, and it feels like a lot of work. And here I am, a pretty privileged trans person, to be able to do this research and find these resources. And I'm comfortable enough in my own queerness to be able to go out there and ask these questions. I can't imagine somebody who is in a place where they're just coming out, or they're in a really hard place in their lives and need support, and have to then also navigate the world and resources that might be available to them without any specific support and understanding as an LGBTQ person.
Yeah, and thank you, because that's, unfortunately, I'm hearing the same thing over and over and over again, but in
Right.
from different contexts.
Yeah.
Can I ask you, why do you think there is no center here? Like, being someone that's coming into this community,
Yeah.
what do you, and also, because from my perspective, when I talk to people, the response is like, we can't do that here. Not because they're like, oh, we shun people. It's just like, that's just too much of an economic, an issue. Like, who's going to house it? It's going to cost money.
Right.
So what is your take on that?
I mean, this is just, Reverend Andree's ideas, but I think part of it is the proximity to New York City. I think a little bit of what I've run into is kind of a response of, oh, well, we can go into the city for that. And again, yeah, I have the privilege and the means to do that. And even somebody with the privilege and means to do that, like, that's a big ask to have all my support needs met in New York City. And I also think too that sometimes I wonder if there's a sense of like, these are no longer issues. So it's true that in 2021, you know, I can be an out trans person in my profession, you know, very public, and, you know, live that way and be that way. Um, and so sometimes I feel like there's a sense of like, well, we don't, the issues of being an LGBTQ person are not the same as they were, you know, back in the 80s and 90s. And that's true, but that doesn't mean that there aren't issues in the community, that there's not need for support, that there's not homophobia and transphobia, you know, rampant throughout Bergen County. So I do think that it's a couple different factors. One probably being the proximity to an area that does have a lot of support, and two, the either the lack of knowledge or the willful ignorance around, you know, issues and needs of support for our broader community here in Bergen County.
Yes, and you said you brought up two things that I kind of I want to highlight. You know, people think go to New York,
Yeah,
and the fact is, because people have this perception of what LGBT people are
yeah,
and who they are, but the reality is there are people who, you know, often LGBT people are being, um, what's what I'm looking for, like identified by family members at a very young age and picked on and segregated. So that means when they go to school, it's a very poor, you know, the more feminine, the more out you are, the more difficult it is, the harder it is to get an education, the harder it is to stay in school. So you have kids that are, you know, either leaving because their home is not livable anymore for them or the situation. So you have a larger homeless population. So having money and those privileges isn't there for them,
right,
you know. And to go somewhere to New York is really, the choice ends up being, do I be homeless in New York and get
right,
some services and abandon my community that, you know, my family could have lived here for generations, but now I can't afford to live here,
right,
you
right,
know. And what is that message that these people are receiving? If that's, you know, it's not a conscious thought, but that is a message. If you have a community, it's just like, we don't see you,
right,
you know.
right. Yeah, and I think so I think there, when I say I'm privileged, I think there's two aspects to that. I think one aspect is what you were just talking about, right? I'm a professional, I'm a middle class professional with a job and the means to be able to access these things, unlike in your example, a teen who's trying to navigate this. The other area of privilege that I have is I'm moving to Bergen County with a pretty broad and deep support network of other queer folk, right? I know people I can talk to, if not in the New York area, like elsewhere. I've got those relationships. Um, if you're a teen just coming out, where do I meet other trans, non-binary, gay? Like, where do I meet other LGBTQ folks who are like me? Is there an environment in my school where I can meet them? Is there another place? Like, without a center, you know, where am I going to find that support? Right, and that support is huge.
Yeah,
That knowing that you're not the only one,
yeah.
right? And that can literally be the difference between life and death for some of these kids.
And you know, it's sort of like a double-edged sword when we're talking about this, because Bergen County, New Jersey, has really championed the LGBT community. We have lots of laws that protect us
Yeah,
and such. And Bergen County has a lot of GSA, that's gay straight alliances in the high schools and stuff, and they have a lot of them that are doing a lot of good work. But there's also a lot of them that are not, and they don't exist.
right,
And it's really our, I don't know enough about that, but I get the sense that it's sort of like either it's arbitrary or it's easy to find reasons as to why not to have a center. And often people are saying, I hear this, just heard it 2 days ago, from professionals, we don't have gay people here. And when I asked, how do you know? They said, well, I can just tell. And I was like, so you never heard, like we'll talk about things very openly. I was like, so you
Right.
never heard people in the closet. And I can't tell. I can't tell someone when they're young if they're transgender, bisexual, pansexual, gay, lesbian. And I've been around a lot and
Right.
I have good gaydar, but I can't tell.
Right.
So what do you think
Yeah.
about?
I mean, that is not criteria, right? And I've heard that from people too, like, oh, well, we don't have any trans and non-binary folks here. I mean, that's usually because I'm part of that community. That's usually the one that I'm talking to. And I'd be like, I think you should always make the assumption that you have trans and non-binary folks, right? Like, I've been in spaces where, because I'm in a leadership role, I've had people come up to me that some of whom I expected and others who haven't, who expressed to me this struggle they're having with their gender, right? And they came to me because there was somebody visible that they could go to. You need that. You can't just shrug and go, well, we don't have anybody here. Um, that's not true.
So I'm taking it that you're supportive of the idea of having an LGBT center. How do you think, let's say in a perfect world, they create an LGBT center, how do you think that will impact our community, having a center all of a sudden appear in Bergen County?
Well, I think that a couple of things that I already mentioned. I think first off, it gives a resource that people can find, that they can be directed to, right? Right now, it's like you have to like pick the different resources that you're trying to access, and you kind of have to do all the work of building that yourself, right? To be able to find out there's this place that I can call or physically go to, like, and that's your access point. That's huge. Even if the center's not doing all the programming and all the meeting all the needs, but has the information and can help connect people to the right services, that's much more
Yeah,
than what we have now.
yeah. And
um, and it sends a message too to again, I'm thinking about folks who are really struggling, LGBTQ folks who are really struggling, like to have a center sends a message that you're not alone, you're not the only one, we know what you're going through, and again, that can be a lifeline for so many of our folks.
Yeah, and I was talking to other people, and representation really means a lot. Not only saying you're not alone, you have a lifeline, but also saying you're accepted,
Yeah.
or saying, life doesn't have to be something you do in the dark, and it's not
Yes.
just about sex. You can actually be a productive part of this community and have relationships and grow and
Right.
be more than just an LGBT person. You can be a part of this community,
Right.
which I think that's what it says to me,
Yeah.
which I grew up without those signs. And you can see the impact on a community, any population that you don't give them those signs of things. You can see there's going to be trauma in that population. And we
Yeah.
have a lot of people here that are dealing with trauma, but no one's seeing it.
Yeah.
Yeah.
Yeah. And
So,
that's the other aspect of this too, though, that I think I just want to lift up something that I think you were just pointing to, which is that another benefit of the center is you have a centralized place that can also be able to speak on behalf of the LGBTQ population for the county, to say, hey, here are the trends we're seeing, here are the needs that we have. And right now, if I'm perceiving it correctly, because there's not one single source, you have people advocating for stuff in different spaces, but there's not one go-to source for
yeah,
that
yeah.
information.
Yeah.
Right?
Like honestly, when I first started this, I was saying, and I'm one to say, there's absolutely nothing in Bergen County for LGBT people, and that's the perception. What
Yeah,
I'm finding out, there is quite a lot in Bergen County,
yeah. You just
and
have to find it.
you just have to find it, and it's just a matter of like connecting those dots, and then also uplifting there are agencies that are slapping up the LGBT flag and getting paid and such like that. I'm not going to go into detail with that, but that are have all the resources to do a lot of good and are not doing that work, even though
Right.
they have everything there and they're
Right.
saying they are. But if they can just do maybe 25% more, and it'll still be bad, it won't be perfect, but that would be so helpful to the people.
Yeah.
We can just easily turn this place around within a summer, you know?
Right.
Yeah. So, do you have any other thoughts or things you want to express?
Well, I think the other thing is, and this is another dimension of what you were just talking about, is there are some groups too within the county who are doing a really good job of advocacy and training, around LGBTQ issues, which is phenomenal and is definitely needed. But with a center, again, there can be even more of that, right? So when you have organizations that are out there that are putting up signs to say we're LGBTQ friendly, like putting up the sign is like the first step. If because I can see a sign and be like, okay, great, there's a pride flag outside, and then go in and be like, do they even know how to navigate my gender, right? Like,
Mhm.
how are they going to deal with that? And if I'm trying to do something uh, really vulnerable and intimate, like say medical services, um, I really, really, really want the people on the other side of the counter to know how to navigate my gender without questioning it, without making me feel uncomfortable or erased or dismissed, right? If I'm feeling vulnerable to begin with, like I don't want that piece on top of it. So education is really, really important for organizations that, like you said, are they just slapping up a sign, um, or getting a grant, but like, are they really doing the work
Yeah.
behind it? That's I mean, I don't know the answer to that. I'm not. I'm not convinced as somebody who's new here that um, there's enough of that happening.
Yeah. And all right, so can I have you elaborate a little bit more of when you're saying going to a doctor
Yeah,
and I understand
yeah.
what you're saying. And I understand the depths of that, but I'm thinking about the person who's looking at this and not really getting where you're coming from and just dismissing what you're saying and saying, "Oh, just deal with it," kind of mentality. What would you say to someone like that?
Who's dismissing the mentality over
Yeah,
like,
they're
yeah,
saying, "Oh, it's like that's because often what you
yeah,
hear is safe spaces. Oh, snowflakes. Not
yeah.
being political, but saying, "Oh,
Well,
you're just being coddled, and that's
right.
not a real issue."
It's not.
Why is
It's
it a
not
real
about.
issue?
Yeah, it's not about being cuddled, right? Like, so you have to remember that so much of our healthcare system, as the example, is built on a binary concept. You're born male or you're born female, right? And so I'm an example where I'm a non-binary person. And if I go to a doctor, there's some things they need to do to treat me as female. There's other things they need to do to treat me as male. And they need to understand that I am not male, even though that's the sex I was assigned at birth.
Hmm.
And if a doctor doesn't know how to navigate that, like, and get confused by what I've written on paper or get confused by my body, like, where does that leave me, right? Like,
Hmm.
and so it's not, yeah, it's not about being a snowflake. It's about trying to get access to services that I need. And if I'm really struggling with something, or I'm in a place of trauma, mistakes around that are just going to compound that trauma.
Yeah, yeah,
um, I'm a relatively healthy individual, luckily, and have learned how to navigate some of that. um, but that doesn't make it any easier. That doesn't mean I want to do that. I want to make sure that there are options available to me, that people know what questions to ask me to navigate that.
yeah. And to highlight that, in one of my previous careers, I worked with survivors of sexual assault.
Right.
And as we know, transgender women, especially transgender women of color, receive a lion's share of sexual assault, physical abuse, murder, and where this comes into real life, talking about your issues, when you have someone that's being sexually assaulted going to the emergency room, you want to have that person who's in trauma, in shock, and going through that trauma. You want to make them feel comfortable and help them through that process. That's
Right.
not the time to sit there talking about genitals,
Right.
and I mean, so that's kind of what I want, because people just see it as like going to the dentist, and I'm trying to show them that it's more. It's a part of your life, and it really impacts people.
Yeah.
Um, you know, so yeah. And so I don't want to take up all of your day. How do you feel? Anything else that you want to bring out?
No, this has been great. I appreciate the opportunity to talk about this. And I'm really glad we're having this conversation because I think it's really, really necessary.
And I really appreciate you, and thank you, because not a lot of people will do what you're doing, and it's amazing to have warriors like you. And just want to say thank you so much.
Well,
I
I'm one
really
of many, so glad to be here along with the rest of y'all.
thank you. Let me turn this off.